Hi everybody and welcome to my channel. My name is Ashley and today I'm going to talk a little bit about one of my conditions called RSD or Reflex sympathetic dystrophy, also known as complex regional pain syndrome or CRPS. And I'm going to do a little story time about how I have got the condition, and then we're going to go and I'm going to talk a little bit about the condition, about what it is and about what it causes. So in 2015, I was in the habit of having my fiance crack my back. I would lay down on the floor or the bed, and he would put his hands on both sides of my spine and press down to crack my back. We did it a million times, no problems. So he came home from work one day, and I asked him to crack my back. And I lay down, and he asked me to lay down on the floor this time. So I did, and that was the big mistake, because immediately, as soon as I laid down and he pushed down, I couldn't breathe. I felt something very large move, and he said that he felt something very large move. And come to find out, what had moved was my entire rib cage. When he pressed down, my rib cage moved upwards, and so it left my rib misaligned by about that much. I walked around for 8 months with a break, with no one being able to tell me what was going on or what was really wrong. I had several x-rays that showed nothing, and I kept telling them, like, no, something is wrong. I don't care what your x-ray says. Do a CT scan, do an MRI. Something is wrong. So finally, after pushing and pushing, I finally convinced them to do a CT scan. The CT did show the break to the 11th rib in the back, and so I was sent to a cardiothoracic surgeon named Dr. Tawan T. Lamb, and he worked out of Memorial Care in Long Beach at the time. And so he performed the surgery in January of 2016, and immediately upon waking up, I was violently ill. I was throwing up. It took multiple doses of anti-nausea medication to control it. And finally, after the vomiting was under control, I asked one of the nurses to take a photo with my phone of my back and to take the dressing off to take a photo. She did, and it was horrific. It was about 3 times longer and bigger than he said it was going to be, and it was black and blue and purple and bruised all the way around it, and I've never seen any other incision look like that. And I've had 9 surgeries before this. I have friends and family who've had surgeries. I had a 10-pound baby pulled from my stomach. So it wasn't my first surgery. It wasn't just, I reacted severely to the surgery because my body was sensitive to surgeries. So that was pretty alarming, and it only got worse from there. I started to get very, very dizzy. Every time I stood up, I couldn't stand for long. I had to lay back down. And so eventually they ran my pallets, and come to find out, my numbers were not what they should be, and I ended up requiring 2 blood transfusions in order to get my numbers back to healthy. And once my numbers were healthy, they released me and sent me home. But I was still actively bleeding because I ended up in the emergency room 2 weeks later in Orange County, because I was actually down visiting my parents. And when my dad came home from work, I told him, I have to go to the hospital now. I'm in severe pain. I could barely stand up. I could barely walk. So I was taken to the hospital, and they told me my 2-centimeter kidney hematoma had grown to a 10-centimeter kidney hematoma. So it had grown 8 centimeters in the time I was released. He sent me home with an active bleed and just made sure my numbers looked good on paper. So I wasn't happy with him as a doctor, obviously, but the pain ended up returning a month later, and I ended up going back to him because he was one of the only people who was willing to touch me, because he was the one who put the plate in, and the plate was meant to be lifelong. And when the pain returned, I started to see a red hook-like shape come off of my incision, and I didn't know what it was. It looked very bizarre. And from there, it just kind of webbed out into this, what I now know is muddling. And at the time, I had never seen anything like that, and neither had anyone I known. And I emailed my doctor, showed him the photos, and he said the same thing. I've never seen anything like that. I don't know what that is. And 6 days later, after admitting that he doesn't know what it is, he's never seen it, he, without testing, decided that I was allergic to the titanium plate. And there is an easy sticker test that they can put on your skin that can tell you if you're allergic to titanium. But instead of doing that, he decided to have another extremely invasive procedure to remove a plate that was never meant to be removed or designed to be removed. So 4 months later, after the first surgery, he went back in through the same incision and removed the plate. Now, I was already at a state where I trusted him so little. I remember actually telling one of the nurses right before I was put out to please not let him kill me. I don't want to die here today. So that shows already I didn't trust him. I thought he was negligent, but somehow I still went to him because I was so desperate to get rid of my pain. So I went back 4 months later, and and I had the second surgery performed. It was supposed to take an hour, and it ended up taking about 5. And he said it took a lot more cranking than he meant that he suspected, which was a really horrible word. I remember thinking, I'm a human being, not a car. You shouldn't say you were cranking on me. You should use a different word. There's got to be better terminology. I do remember thinking that, and sure enough, about the same thing about a month later after the surgery, the pain returned, only way, way worse. And at this point, I did not trust him, so I went back to my primary care doctor, who took one look at my back, listened to my symptoms, and said, I know what this is, and diagnosed me with RSD. And at the time, I had never heard of it, and she had actually diagnosed me using the term CRPS, Complex Regional Pain Syndrome. And when I heard syndrome, I thought, oh, okay, like, I'm in pain now, I'm having an issue now, but it didn't make it seem like it was lifelong. So it wasn't until I got home and I Googled RSD or CRPS that I really started to have a better understanding about what it is. So, 3 years from the original surgery date, I am stage 4. It is in the outside and the inside of my body. It affects pretty much everything. My nervous system, my muscles, my bones, my heart. I suffer from, I suffer from hypertension sporadically. Sometimes my blood pressure can be perfectly normal, and other times it'll be so high I'm on the verge of having a massive stroke or heart attack. And sometimes it'll do the opposite, and it'll be polar, really, really low. So it's in my back, my rib cage, my right arm, my left leg, my heart. Did I say my neck? My neck. It's pretty much inside and out. At full body at this point. I suffer from the severe hypersensitivity. Even non-painful stimuli hurts, vibrations, loud sounds. I have severe muscle spasms. I am pretty much wheelchair bound. I am in severe pain. Nothing manages it, although I do have a pain management doctor who is desperately trying to help me. He's tried almost everything he can other than other surgeries, and I'm just absolutely suffering. My quality of sleep is not great because it's hard to sleep when you're in that much pain. So just to talk a little bit about what RSD is, now that I've told you how I got RSD. So RSD, as I said, stands for Reflex Sympathetic Dystrophy. There is no cure or no effective known treatments for RSD. RSD is a malfunction of the nervous system. It's basically when your spinal column keeps sending pain signals to your brain when it shouldn't be. RSD is considered to be a rare disease. Symptoms can include, but are not limited to, severe 24/7 pain, severe swelling, skin and nail changes, skin muddling, joint pain, organ involvement, severe sensitivity to non-painful stimuli, nerve pain. Almost 70% of all RSD patients will have spreading to different areas of the body, inside and out. Anybody can get RSD. The known causes are trauma to the area, soft tissue damage, surgery, even minor ones, broken bones. Sometimes it can actually pop up for no reason whatsoever. RSD is rated to be the most painful condition known to man. It rates above cancer. It rates above broken bones. It rates above childbirth without medication. It rates above amputation without medication. And that pain is 24/7 all the time, not just, for a few hours or a few weeks or a few months. People are used to, when they are injured, every day waking up and being a bit better, but with my condition it's progressive, so every day I feel a little bit worse. I have lost nearly all of my friends and have replaced them with other chronically ill people who have now become my family. They have been there for me more than the so-called real life friends that I've had and known for 16 plus years, who did not hesitate to drop me like a hot potato the minute I was no longer fun Ashley. So, for that reason, that's one of the reasons that it can cause depression, but RSD often causes severe anxiety and depression. The depression is oftentimes so bad and so intense that people with my condition often end up taking their own lives, so often that it is actually nicknamed the suicide disease. And that is because more people with RSD kill themselves than any other chronic condition that there is. So our rate of suicide is significantly higher than any other chronically ill group of people, people who have other chronic illnesses. Because there's just nothing, it's so painful, and there's no treatments, and so many doctors and nurses know absolutely nothing about this condition. So it's incredibly hard to live with. So anyways, these are the facts about RSD. I am going to be posting some more awareness videos about my other conditions along with some other videos, so keep an eye out for those. And please leave a like or comment and subscribe and let me know what you think. And if you know of somebody who has RSD, go give them a hug and let them know that you're there and you care. All right, have a good day. I'll talk to you guys later. Bye.